A very good morning to my lecturer, Dr. Yu, and my fellow friends who are watching my video. My name is KAUSALYADEVI, Doctor of KANDASAMY. I'm a Bachelor in Biomedical Science student. Today, I'm going to talk about a disease that related to our year. So let's go. So the disease that I chose that which is related to our year is presbycusis. What is the meaning of presbycusis? Presbycusis is the loss of hearing that gradually occurs in most individuals as they grow older. So it always affects the older people than the younger ones. What it does is it affects the cochlea, the spinal cavity of the inner ear, containing the organ of corti, which produces the nerve impulse in the response to sound vibration. So, which is very important in hearing. That's what the presbycusis affects. So, let's see where the cochlea is. So, this is the anatomy of our ear. We have three parts in our ear. One is the outer ear, second is the middle ear, and the third is the inner ear. So, the cochlea is in the middle ear, in the inner ear. This is where the presbycusis actually affects. So let's see what causes this particular disease. It affects of repeated exposure to daily traffic sounds or construction work, noisy offices, equipment that produces sound, vascular caused by diabetes or other circulatory problems. So when we are going to our office or school, we are always exposed to the traffic sounds, the construction works, right? So this is the main one of the main reasons that causes presbycusis. Sometimes when we are working, we will have been in noisy situations such as noisy office, noisy school, and wherever we are in. Other than the equipment that produces noise, such as headset, our phone, when you're hearing music, loud music can cause sensorineural hearing loss. So we have to always beware of it. Other than that, changes in the blood supply to the ear because of the heart disease also happens. Let's say if you have a very good, healthy hearing habit, but you have a heart disease, you might have presbycusis too. Because it's not just because of hearing; it's sometimes it's because of blood supply too. High blood pressure, vascular caused by diabetes, also will affect our body. So, what are the symptoms that we can see? Is a mumbled or slurred speech, high-pitched sounds such as S and T are difficult for us to hear and to tell apart. Conversation are difficult to understand, especially when there is a background noise. A man's voice is easier to hear than a highest pitches of a woman's voice. That's what a study shows. A ringing or a hissing sound in one or both ears sometimes may occur also. Okay, so let's see the treatment, what we can do to avoid this kind of presbycusis. Okay, so we don't really have a perfect treatment for this. We can always prevent it. So we have personal hearing protection like earplugs, ear muffs, active noise reduction, and other than that, non-specific management, optimization of acoustic environment such as the background, which is very noise, increase face-to-face communication rather than using our phone and other equipments. When you talk face to face, they are more able to understand it and hear it more. Rehabilitation of programs such as psychological counseling and lip reading classes are very good for this kind of disease too. So it affects 1 out of 3% by age of 65 and 1 out of 2% by age of the 75. So it always affects the older person. So I would like to advise the younger ones who are always having the headphones on and exposed to traffic jams, traffic sounds, and some other hearing problems and hearing things. Stop it, and if you can just avoid this kind of thing so that you don't have this kind of disease when you get older. So I hope you guys do understand and gain some knowledge from our disease today, which is presbycusis. And thank you so much for watching my video. Thank you.